Hello everyone. Today we are going to study pediatrics from Rome's. Rome's 15th edition, page number 1180. First, we're gonna study about fetal medicine. Fourth chamber heart is formed at the 6th week of IUL, that is intrauterine life. Fourth chamber is formed at 6th week of IUL. Nail and neck appears in third month of IUL, that is nails and neck appears in third months of intrauterine life, that is third months of intrauterine life. Fetus is most sensitive to teratogenic drugs, that is 3 to 8 weeks. Fetal is most sensitive with teratogenic drugs, that is 3 to 8 weeks. Fetus is more sensitive to radiation effects, that is 8 to 15 weeks. Fetus is more sensitive to radiation effect, that is 8 to 15 weeks. So what we learn here, that is 4 chamber heart is formed at 6th week of IUL, intrauterine life. Nails and neck appears in third month of intrauterine life, and fetus is more sensitive to teratogenic drugs is 3 to 8 weeks, and fetus is more sensitive to radiation effect, that is 8 to 15 weeks. So next is we have advanced age of mother more than 35 years is related to high incidence of, so those mothers whose age is more than 35 years could be problem with lots of diseases. I'm going to talk about first we can learn through the mnemonics, that is MD peds mom. We have a mnemonics called MD peds mom. M means mental subnormality, D means Down syndrome, PED ped, P for premature labor, E for Edwards syndrome, D for dizygotic twins, and SCNS defect. And we have another advanced paternal age more than 50 years is associated with. So here we have paternal age, advanced paternal age whose age is more than 50 years, gonna associate with some disease. So we can also learn this through mnemonics. Mnemonic is Mac, Doc, Papa. MAC, DOC, PAPA. Papa is just a small words. We have MAC, DOC, Mac, Doc. M for Marfan syndromes, A for achondroplasia, C for craniostomy with syndactyly, that is Alport syndrome, MAC, MAC, DOC. D for Down syndrome with fusion of chromosome 21 and 22, MAC, DOC. DO for osteogenesis imperfecta, DOC for congenital deafness and some CHDS, that is congenital heart diseases. Mostly diseases are related to skeletal system, that is MAC, DOC, PAPA, MAC, DOC, PAPA. So paternal, those paternal age more than 50 years, gonna associate MAC, M for Marfan syndrome, A for achondroplasia, C for craniostonosis with syndactyly, that is Alport syndrome, MAC. D for Down syndrome with fusion of chromosome 21 and 22, MAC, DOC, and DOCC for congenital deafness with some CHD, that is congenital heart disease. Next is antenatal predictors of chromosomal disease. So we have first disease Down syndrome. Down syndrome. Down syndrome is increased nuchal fold thickness, reduce FL on USC. And next is maternal serum HCG plus inhibin. decrease PAPPA, decrease F alpha fetoprotein, that is AFP, decrease EU3, that is estriol, it's also estrogen. Hall's criteria are used for diagnosis of the Down syndrome. Remember that only HI is high, rest all are down in Down syndrome. So we have a mnemonics here. In Down syndrome, HI is high, all are down. Means H means that is beta HCG. HCG is down. I means inhibin. So HCG and inhibins are down, all are high. Next we have Patau syndrome. Patau syndrome is Patau syndrome is due to mutation due to problem in gene number 13. Okay, 13 number. That's why it's called trisomy 13. Problem in the trisomy 13. So because of this, we call it Patau syndrome. And in Patau syndrome, there's problem that's hollow prosencephaly, cleft lip or palate, echogenic kidney, polydactyly, rocker bottom feet, microcephaly. So P for Patau here is HOLOP. So we can remember hollow prosencephaly, cleft lip or palate. Also P for palate, P for Patau. Next is echogenic kidney and polydactyly. P for polydactyly and P for Patau. And next is rocker bottom feet, microcephaly. Next disease is Edwards syndrome. Edwards syndrome is due to problem in trisomy 18th number of chromosome. That's trisomy 18. So here we have spina bifida, cerebral agenesis, radical aplasia, single umbilical artery, clubfoot. Diagnostic test for CDA, that is congenital dyserythropoietic anemia. Dyserythropoietic anemia. Type 2, that is HEMPAS test, that is hereditary erythroblasts multinuclearity with positive acidified serum lysis. That is HEMPAS test. Gigantoblasts are seen in congenital dyserythropoietic anemia type 3. That is gigantoblast. It's seen in congenital dyserythropoietic anemia type 3. Okay, next we have drugs taken during pregnancy and fetal effects. That is also called teratogenic drugs. So we have first anti-epileptic drugs which can affect on the baby. That is first phenytoin. It's on class D. Phenytoin can affect on baby like fetal hydantoin syndrome, microcephaly, cleft palate, palate or lip, low set ear, absent nails, hypoplastic phalanges, IUGR, that is intrauterine growth retardation, neuroblastoma, bleeding due to the deficiency of vitamin K, IgA deficiency, pulmonary stenosis. So we learn here due to phenytoin, there is lots of effect on the baby, that teratogenic effects, microcephaly, cleft plate or lip, low set ear, absent nails, hypoplastic phalanges, IUGR, neuroblastoma, bleeding due to vitamin D deficiency, IgA deficiency, pulmonary stenosis. All are the effects of phenytoin. Next we have carbamazepine. Carbamazepine causes spina bifida developmental delay. Next we have phenobarbital, that is relatively safe. Cleft lip, palate, CHD, that is congenital heart defect or disease. Next we have valproate, also anti-epileptic drug. It can lead neural tube defects, NTD, neural tube defects, and hypoplastic left heart, coaction of aorta. So during the pregnancy time we should not give these drugs because it can cause lots of effects, side effects and teratogenic effects. First, valproic acid cause neural tube defects. Next is hormonal preparations, that is hormonal preparation, that is progestin can cause masculinization of female fetus, uh, hypospedia, hypospediasis in male fetus, and acceleration of fetal bones age. So next we have uh, DES. DES DES can cause in female offspring. For first of all we're gonna talk about this, then after we're gonna talk about male offspring. In female offspring, most common is vaginal hypoplasia, adenosis, T-shaped uterine cavity, septate cervix at birth, incompetent OS, clear cell vaginal adenocarcinoma later on at 15 to 20 years of. So this question has been asked multiple times. Clear cell vaginal adenocarcinoma, clear cell vaginal adenocarcinoma, it is because of DES. It causes in female offspring and later on, that is 15 to 20 years later on, in male offspring, increased risk of testicular cancer in later life, hypospadiasis, testicular hypoplasia, cryptorchidism, OCP's use and withdrawal. So we have, because of OCP's use and withdrawal, there is also teratogenic effects. It could lead limb reduction, deformity, pectoral association, vertebral anal, cardiac, tracheoesophageal, renal limb anomalies. Next drug we have clomiphene citrate, that is clomiphene. Clomiphene can lead neural tube defect, Down syndrome, ovarian hyperstimulation syndrome, and multiple births. So next we have prednisolone. Prednisolone can cause oral clefts. It can lead oral clefts. Next we have diazepam. That is diazepam from the benzodiazepine groups. Can lead cleft palate, lip withdrawal effects. Next, drugs of abuse or psychoactive drugs, that is psychoactive drugs or abuse drugs that we have, like alcoholism. Those on alcohol, who drinks alcohol can lead fetal alcohol syndrome, that is, and fetal alcohol syndrome, and IUGR, that is intrauterine growth retardation, microcephaly, facial dysmorphism, flat faces, maxillary hypoplasia, philtrum, small philtrum. This is called philtrum, so it will be a small. Ptosis means a droplet of eyelids, like this, droplet of eyelids. Strabismus, ear anomaly, etc. Hemangioma, autism, and ADHD, that is attention deficit hyperkinetic disorder, ADHD, skeleton, cardiac defect, that is AST more than BST. AST is atrial septal defect and BST is ventricular septal defect, and other anomalies, that mental subnormality, postnatal mental physical growth retardation, short stature, that decrease length, weight, height, everything gonna decrease. Borderline to severe, borderline to severe MR. Next we have cocaine. Cocaine can affect abrupto placenta, preterm labor, cerebral infarction, and Mobius syndrome. Next drug we have heroin. Heroin can lead in irritability, hyperactivity, tremor, concentration in infancy. Next is smoking that, as we know, smoking or cigarette or anything that contain nicotine can lead LVW, that is due to under perfusion. LBW is low birth weight. So because of smoking, uh, it can lead low birth weight under perfusion due to under perfusion. Next we have IUGR. As we know, IUGR means intrauterine growth retardation, and um, we have increased risk of stillbirth, placenta previa, abrupto placenta, cleft lip, palate, mental retardation, increased level of carbon monoxide in maternal blood, and functional inactivation of maternal and fetal hemoglobin. Next drug is LSD. Oh my god. LSD can lead fractured chromosomes, uh, anomaly in fetus. Lots of anomaly, fractured chromosomes, anomaly in fetus. Next is amphetamine. Amphetamine can cause also IUGR. It can lead intrauterine growth retardation, CHD, that's congenital heart disease. Next is withdrawal symptoms. Next we have anticoagulants. Anticoagulants like decomerol. Decomerol can cause IUD, that is intrauterine death, severe bleeding in neonates with degenerative coumarin. Next is warfarin. That is warfarin is category X. Category X. That is also called category E. We know drug have category A, B, C, D, E. Category E is also called cat X. Warfarin and heparin. Warfarin gonna do war, so we have to remember warfarin is not good for baby. Warfarin, fetal warfarin syndrome, Candrid syndrome, birth defects, abortion, hypoplasia of nasal bones, extremities, stipple, epiphysis, calcification resembling chondrodysplasia punctata, mosaicistic. IUGR, CNS abnormality are reported if second and third trimester exposure, and CHD, that is congenital heart disease. Next is miscellaneous drugs, that is ACE inhibitor, ACE, that is angiotensin converting enzyme inhibitors, and iatrogenic effects of ACEs, renal tubular dysgenesis, lung hypoplasia, anuria, oligohydramnions. There is lots of questions about ACE inhibitor, why ACE inhibitors are contraindicated in during pregnancy. So we know this can lead to iatrogenic effect, which is renal tubular dysplasia, lung hypoplasia, and anuria, oligohydramnions. Next drug is misoprostol. Misoprostol Misoprostol can lead arthrogryposis, cranial neuropathy, facial dysplasia, others, that is CNS problems, that is autism, also can lead hypogonadism, that is Mobius syndrome. Mobius syndrome. Next drug is miscellaneous drugs, that is lithium. As we know, lithium is I mean, very bad. We should not give lithium during pregnancy because it can lead very big problem with the heart, that is also called cardiac malformation, that is called Epstein anomaly, and fetal goiter. It can lead fetal goiter and Epstein anomaly. So we have to remember lithium have a very, I mean, bad teratogenic effect, that is cardiac malformation, that is Epstein anomaly. Next is mercury exposure. Oh my god, mercury exposure is one of the there is one historical disease which is called Minamata disease of Japan. It can, because of this mercury exposure, it can lead microencephaly and cerebral palsy. So it's a very bad one. Next drug is thalidomide. Thalidomide is it can lead phecomelia. As we all know, phecomelia means long bone defects, limb reductions, abnormality. Some kids born without the limbs, I mean defect in the long bones, no hand or something like that. mm, that is called phecomelia. It's because of the disease called because of the drug called thalidomide. Next is vitamin K synthetic. Because of vitamin K synthetic, there is hemolysis. It could be it could lead to hemolysis, hepatotoxicity, severe neonatal jaundice. And next is vitamin D. Because of vitamin D, hypersensitive syndrome, that's Williams syndromes, and infantile hypercalcemia plus elephantiasis plus supravalvular aortic stenosis. It can lead supravalvular aortic stenosis. Next is isotretinoin vitamin A analog. Isotretinoin vitamin A analog can lead acute embryopathy. Acute embryopathy, that is neural tube defect, renal, craniofacial, ear, cardiac anomalies, um, conotruncal anomalies. Next drug is thiazides. Thiazides can also inhibit megakaryocytes, fetal thrombocytopenia. So there will be low platelets in the fetus because of these thiazides, and it can also damage liver. So thiazides can inhibit megakaryocytes, which lead fetal thrombocytopenia. Uh, it means platelets counts below than normal in the fetus. And next is liver damage. Next drug is tetracycline. As we know, tetra tetra leads to teeth discoloration. So we can remember through tetra with teeth. There will be discoloration of teeth in the fetus because of exposure with tetracycline. So it is also contraindicated during pregnancy, as we know. It can lead um, pigmentation of teeth, that is intense yellow teeth. Cataract, also it can also cause cataract, hypoplasia of enamel, pigmentation of teeth, that is intense yellow teeth. Next drug is chloroquine. Relatively safe, but may cause deafness in the children. So it is also bad effects of chloroquine. Next drug is chloramphenicol. As we all know, chloramphenicol cause gray baby syndrome. So uh, it's also important questions uh, for UG and PG exams. Chloramphenicol can lead gray baby syndrome. Next drug is quinine. Quinine can lead abortion, immune mediated thrombocytopenia, deafness, CHD, and limb defects. Next drug is fluoroquinolones. That is fluoroquinolones can affect the cartilage, that is cartilage defects. Next is erythromycin. Erythromycin can could lead pyloric stenosis. Next drug is streptomycin. Streptomycin can cause deafness. So this portion is complete. Next is category of drugs taken during pregnancy. We have category A, B, C, D, E. Category E is also called category X. A means no fetal risk. B means no fetal risk is demonstrated in animal or human study. So A means it's relatively safe. B is also safe, as we know no fetal risk is demonstrated in animal or human studies. So for category B, there is some example like cephalosporin, penicillin, erythromycin, clindamycin, nitrofurantoin, ritonavir, sacubitril, AAMB, praziquantel, and piperacillin. Category C, no adequate human studies, risk can't be ruled out. So no adequate human studies, because of no adequate human studies, we cannot rule out the risk. So next is D. D means some evidence of fetal risk. So we know there is some evidence of fetal risk, that is tetracycline, which can also lead discoloration of teeth and cataract, and streptomycin, and metronidazole in first trimester. So next is category E, that is also called category X, which is proven fetal risk contraindicated. That is example of category E is quinine. Next, we're gonna talk about most vulnerable period of organogenesis is between 18 to 15 days or 3 to 8 weeks of gestation in the first trimesters. If teratogenic drugs are taken after 55 days, that is developmental and functional abnormality may result. If teratogenic drugs are taken after 55 days, um, developmental and functional abnormality may result. Cessation of smoking during pregnancy has been shown to result in increased birth weight. So cessation of smoking during pregnancy has been shown to result in increased birth weight. Now we're going to talk about the high yield points, that is Mobius syndrome. What is Mobius syndrome? Mobius syndrome is caused by maternal use of misoprostol, cocaine, thalidomide. It is characterized by underdeveloped 6 and 7 cranial nerve. Cranial nerve 5 and 8 may also be involved. Cranial nerve 5 and 8 may also be involved. Cleft lip and palate caused by diazepam, imipramine, phenytoin, and prednisolone. Maternal intake of salicylates, aspirin, thiazides, quinine is associated with neonatal bleeding because of thrombocytopenia. So we know salicylate, that is aspirin, thiazides, quinine. These drugs can lead bleeding, neonatal bleeding. Next, maternal intake of the drugs of addiction, example morphine, pethidine, diazepam, alcohol, barbiturates, results in withdrawal syndrome in neonate. So treated by neonatal opium solution and neonatal morphine solution, that is NOS and NMS. Insulin, PTH, calcitonin do not cross placenta. So there is multiple questions about these things also. Insulin, parathyroid hormone, that is PTH, and calcitonin. Insulin, PTH, and calcitonin cannot cross placenta. Most important hormone required for intrauterine growth is IGF-1. Intrauterine growth factor 1. Next topic is drugs taken by mother during perinatal period and important effects on neonates. First of all, we're going to talk about oxytocin used for induction in mother. It can lead hyperbilirubinemia in girl babies. Next is prolonged cortisone. It can lead adrenal crisis in infants. Next is NSAIDs, that is non-steroidal anti-inflammatory drugs, which can lead premature closure of ductus. Next is dexamethasone. Periventricular leukomalacia. It can lead periventricular leukomalacia. Next is medications to the baby. Chloramphenicol can cause gray baby syndrome. erythromycin, pyloric stenosis, vitamin K bleeding, hepatotoxicity, severe NNHB. And now again we have high yields points. Drug increase severity of hyperbilirubinemia and precipitating connectors involved large dose of synthetic vitamin K, that is quinine, sulfonamide, salicylate, caffeine, novobiocin, gentamicin. Phenobarbital induces maturation of UDP, glucuronide transferase, and Y-acceptor protein, and thus protects the baby from development of severe jaundice. Next is fetal therapy. Fetal therapy deals with treatment of fetus diseases during the intrauterine life. For NTD, that is neural tube defect, treatment with folic acid 0.4 mg per day 1 month before 2-3 months of pregnancy. 1 month before 2-3 months of pregnancy. So we have to give 0.4 mg per day 1 month before 2-3 months of pregnancy. 4 mg per day if previous fetus is affected. If there is previous fetus is affected, then we have to give 4 mg per day, 4 mg, not 0.4, and this time we have to give 4 mg per day if previous fetus is affected. Another condition is CAD, CAH. So CAH is congenital adrenal hyperplasia, and for CAH treatment is dexamethasone to mother 0.25 mg PO QID till determination of sex of baby. Next is thyrotoxicosis, that is fetal. Treat mother with propylthiouracil, that is 300 mg per day. Propyl PTU, that is 300 mg per day. For thyrotoxicosis, fetal hypothyroidism, L-thyroxine, levothyroxine to mother 500 mcg every second week intraamniotic. Every second week. Next is methylmalonic acidemia, hypothyroidism, that is B12 tapped mother. For log maturity, we have to give dexamethasone to mother 60 mg IM 12 hourly for 4 dose, or betamethasone 12 mg IM for 24 hourly into 2 doses. The next is fetal SCT, that is stem cell transplantation. Treatment is thalassemia, immunodeficiency, IM. Fetal SVT, that is suprapendicular tachycardia. Treatment is drug of choice is digoxin. Remember, for neonatal SVT, adenosine is drug of choice. So for neonatal, we have to give adenosine, that is a drug of choice. But fetal SVT, we have to give a digoxin, that is drug of choice. Next chapter is infant of a diabetic mother. So diabetic mellitus is a commonest endocrine disorder met during pregnancy. Maternal high blood glucose level is reflected in the fetus as hyperplasia of the islet cells of pancreas. Maternal high blood glucose level is reflected in the fetus as hyperplasia of the islet cells of pancreas. Positive anabolic effects of excess insulin result in LGA baby or fetal macrosomia. So because of this positive anabolic effects of excess insulin result in LGA and fetal macrosomia. Maternal high blood glucose level is reflected in the fetus as hyperplasia of the islet cells of pancreas. Positive anabolic effects of excess insulin result in LGA, that is large for gestational age, that is LGA, um, baby or fetal macrosomia, septal hypertrophy, and cardiomegaly. Everything large. So we can remember through this. First day hyperglycemia is most common. First day hyperglycemia is most common manifestation developed in 25% of babies but usually asymptomatic. First day hypoglycemia is most common manifestation developed in the 25% of baby but usually asymptomatic. So we have to remember first day baby can go in hypoglycemia, that is most common manifestation. Clinical features: baby is usually large for gestational age. Macrosomia and organomegaly are seen. Large, plethoric, that is polycythemia, and moon face. Face will be like moon face. Hyperthyroidosis are seen. Hairy pinna is pathognomic. Hairy pinna is pathognomic. Okay. The liver, adrenal gland, and heart are most likely to be enlarged, but the size of brain and kidney are not affected. Source: midline plus. Level of glycosylated hemoglobin HbA1c in the maternal serum is directly related to incidence of congenital malformations in first trimester and fetal macrosomia in the third trimester. So, level of glycosylated HbA1c in the maternal serum is directly related to incidence of congenital malformation in the first trimester and fetal macrosomia in the third trimester. So, we must check first and third trimester HbA1c. Estimation of post phosphatidylglycerol in amniotic fluid, NOT/LS ratio, is the most reliable test to assess fetal lung maturity in months with diabetes mellitus. So phosphatidylglycerol is in an amniotic fluid. That is most reliable test to assess fetal lung maturity in mother with diabetes. Most common complication during the NVD in a diabetic woman, that is most common complication during NVD, that is normal vaginal delivery in a diabetic woman: shoulder dystocia due to fat deposition over shoulder. So most common congenital anomaly in the infant born to diabetic mother is CVS anomaly, asymmetrical septal hypertrophy, which regress spontaneously by 4 months. Most common complication was during normal vaginal delivery in the diabetic woman: shoulder dystocia due to fat deposition over shoulder. Most common scientific heart disease in infants of diabetic mother is TGA, transposition of great arteries. Sacral agenesis, caudal regression syndromes are characteristics. Most specific congenital anomalies: BST, CM, HCM, that is hypertrophic cardiomyopathy. Cardiomyopathy may be seen, and neural tube defects are less common as compared to CVS defect, in which is spina bifida greater than caudal regression syndrome, more than caudal regression syndrome. Other finding: hypocalcemia, hypomagnesemia, hyperbilirubinemia, hypoglycemia, HOCM, hairy pinna, high RBC, mass, polycythemia, remember with 7 H. So that is hypocalcemia, hypomagnesemia, hyperbilirubinemia, that is hypoglycemia, HOCM, hairy pinna, high RBC mass, that is polycythemia. There is an increased incidence of HMD as insulin suppress surfactants productions. Monilian vaginitis seen in infants of the diabetic mother. Risk of fetal congenital malformation are more if hemoglobin HbA1c value rise to more than 9.5%, 10.4%. Estimation of fructosamine reflects the glycemic control for the previous 2 to 4 weeks. Estimation of GSE, that is glycosylated as albumin, is a sensitive indicator for short-term glycemic control. Maternal serum alpha-fetoprotein at 16 weeks of gestation and anomaly scan at 18 to 20 weeks, including echo at 20 to 22 weeks, are useful for detection of fetal anomaly in second trimester. HbA1c value rising more than. So this model, maternal serum alpha-fetoprotein at 16 weeks and anomaly scan at 18 to 20 weeks, including echo at 20 to 22 weeks, are useful. Another topic is intrauterine infections and outcome. We're gonna talk in another model. Thank you.